In honor of Breastfeeding Awareness Month, we asked a few moms why they decided to breastfeed and what advice they have. Find out what those moms had to say coming up on A Healthier You. Hello, I'm Kelly Schermerhorn with Catawba County Public Health. I'm here with Laura McPherson, and she's a breastfeeding peer counselor in our Women, Infants, and Children program, also known as WHKY. Laura, can you tell us, why are we celebrating breastfeeding awareness?
Well, we are celebrating breastfeeding awareness not only in the month of August, but all throughout the year to just let our breastfeeding mothers know how we support you and how we are just so proud of you for choosing to do this for your baby, and all those moms who have breastfed. We want them to know how much they have done for their children and how wonderful it is.
Great. Well, I think a celebration to acknowledge and encourage people to breastfeed is a great idea. Let's talk a little bit about the benefits of breastfeeding.
Certainly. Breastfeeding is a wonderful way to bond with your baby, and the American Academy of Pediatrics states that for the first 6 months of life, with exclusive breastfeeding, no other water, juice, or anything else, your breastfed baby will be less likely to have allergies, earaches, weight problems, tooth decay, diarrhea, upper respiratory infections. Research-based evidence shows that sudden infant death syndrome is reduced from breastfeeding your baby.
Wow. That's a full list of benefits to breastfeeding. I don't know what else you could need to want to breastfeed, but let's find out what one of our local moms had to say as to why she decided to breastfeed.
I think the reason why I decided to breastfeed was that I just knew that it was the natural thing that God intended, and I wanted to, and it was free. I didn't have to, supplement in any way. It was something that just naturally happens that's just been a blessing. And I would say that it was, of my motherhood, I would say breastfeeding has been the number one thing that I've enjoyed of a bonding experience for my children, and helping also to get your body back to normal, the way you like it, the way it was before. But the biggest thing I would say has just been a very natural, the way that God intended, your body and your baby, your nourishment for your baby, and for the betterment of your body, health-wise.
Breastfeeding, like any adventure or journey you go on throughout your lifetimes, is going to have ups and downs. And that's why it is vital for these mommies, whether new mommies, second-time mommies, have the support from your family, your friends, your healthcare providers. Us here in WHKY, breastfeeding peer counselors, are here for you to answer questions and concerns that you may have. You have to be a WHKY participant to get our breastfeeding peer counseling services, so come join us at WHKY. We also just want to encourage and support those moms who have decided to breastfeed, and just get them over those little humps and in the first couple weeks. And being a new mom, you have lots and lots of questions, but like I said, with any adventure, you're going to have your ups and downs, and you can do this. You can breastfeed, because that's what we're meant to do as women for our babies.
Yeah, well, that's certainly great advice for overcoming challenges. I think, too, for some moms going back to work, you provide some other support, right?
Yes, ma'am. Yes, ma'am. Being part of WHKY, we have services where we can give you an electric breast pump if you qualify from the guidelines from the state of North Carolina. We'll be able to help you with a breast pump so that you can continue to breastfeed when you go back to work.
Great. So finding a support group and having resources if you go back to work are all great examples of how to overcome various challenges. But again, we had the opportunity to talk to moms from our very own community. So let's find out what one of those moms had to say and what advice she gives new moms.
The advice I would give new moms is to go ahead and try breastfeeding, because it is great for your children, and that if you think about giving it up just because it doesn't work the first time, to keep on pressing through, because I believe it really truly helps you bond with your children. Furthermore, it helps with Shaheen, he never got sick when he was a baby. So I really truly believe that works also. And if some people like try to tell you to stop, like just because they're going past another age, don't listen to them, because you have to go by what your child wants and what your child needs, because it's all about them. So just continue to do what you're doing, and if you need support, always call the WIC office.
How does someone qualify for WIC?
Okay, WIC is for women who are pregnant or postpartum, infants, and children up until the age of 5. It is a supplemental nutrition program, so you must live for WIC here in North Carolina. You must live in North Carolina. If you have food stamps or Medicaid, it is an automatic qualification for WIC. So if you are receiving Medicaid or you have food stamps, you can get WIC from our program. Now, it's also available if you have your income screened. So we have income guidelines. You call the WIC office, 828-695-5884, and they can screen your income over the phone, because of course we want to help you as much as we can, and we can let you know immediately if you're qualified for WIC services or not.
Great. Well, Laura, I really appreciate all the insight and advice you've provided today. So again, we're here celebrating breastfeeding awareness not only in the month of August, but throughout the year. We want to celebrate those moms who are thinking about breastfeeding, who are already breastfeeding, or who have breastfed in the past. And we want you to know that WIC is here as an available resource, but also because we support breastfeeding in general, we want you to talk to the hospital that you delivered at, find out if they have a support group available for breastfeeding, and you can also look into the Affordable Health Care Act at the website healthcare.gov. Sometimes insurance policies might allow the breastfeeding pumps for free, like you mentioned, or counseling. So again, that's an alternative. But we would encourage you to find out if you qualify for our WIC services. You can call 828-695-5884. Thank you.